know the warning signs of stroke. So when they identify it, they can call 911 immediately. Be fast.
A stroke is where someone has a large clot that goes up to the brain. We then use devices to try and take out and remove the clot to restore blood flow to the brain to improve function of the patient.
You can see they're pulling down the clot and the device, and the clot holds on to the device as it's coming down, and that's the conclusion.
Coming here for the opportunity to learn more about strokes and the procedures that they use.
With stroke, every minute counts.
Here at Monterey Park, we do get a lot of stroke victims, so it will help us tremendously to not have to transport to a farther hospital and be able to come here to Garfield.
The doctor will remove this stent retriever, and a lot of times you'll see the clot fragments on this stent retriever.
This is a stroke community awareness event. We want to raise awareness about stroke. So when they identify it, they can call 911 immediately and go to the emergency room. In the emergency room, we can give appropriate treatment right away. We do CT scanning of the brain so we can see if there's a bleeding in the brain or if there's a clot in the brain. And then we have treatment options for either the bleed and for the clot. Be fast. So be any person who have a sudden onset of dizziness, loss of balance is a possible stroke. Also patients with any eye changes such as vision loss or blurry vision, it can also be a stroke. And we also have the face, such as the facial drooping, that is a possible stroke. And for A is for arms or legs. People who have a sudden onset of weakness or numbness on the arms or legs, that's a possible stroke. And for S is for the speech. Any slurred speech or unable to talk, any difficulty speaking is a possible stroke. So please, if you have any symptoms of stroke or any of your family member, please call 911 or go to the nearest emergency hospital. Here at Garfield Medical Center, we are a primary stroke center and we're also capable of doing thrombectomy. So please come to the hospital immediately, because with stroke, every minute counts. Every minute that goes, 1.5 million neurons die. So we have to make sure that you get to the hospital so we can do the treatment right away.
My name is Dr. Schnorr. This is a thrombectomy setup that we do to take out clots for large vessel occlusion. So basically, a stroke is where someone has a large clot that goes up to the brain. We then use devices to try and take out and remove the clot to restore blood flow to the brain to improve function of the patient. So this is just a small setup that we have here. We just imagine that there's a clot sitting right here. We take a small tube that goes all the way up to where the clot is. We engage it. We then use a small device called a retrievable stent to go ahead and move across the clot. We let that wait about 5 minutes for the clot to incorporate. We then remove the device. We also have another device that will come up to basically try and suck the clot out. All of this is then removed. We do another injection to make sure that the blood flow is restored to save the patient's life.
So this is just an animation of a mechanical thrombectomy with the solitaire device. Typically enter through the femoral artery in the groin. You bring a big catheter up, as it just showed. So at that point, what they'll do is now they're introducing the microcatheter over the guide wire, and they're crossing the clot, and now they're going to deliver the mechanical thrombectomy device, the Solitaire X. And there it is, and then they'll pin the wire and they'll unsheath the catheter so the device stays where it is and the catheter gets out of the way. So you see the device deploying, and as you can see, the device has engaged with the clot. So they'll leave that there for 3 to 5 minutes, and that allows the clot time to engage with the device. You can see they're pulling down the clot and the device, and the clot holds on to the device as it's coming down, and that's the conclusion.
Hi, my name is Joey Shiraishi. I'm with the Alhambra Fire Department. I'm a firefighter paramedic. I've been at the department for about 5 years now. We transport here to Garfield Medical Center for a lot of our transports. It's one of our closest hospitals that we can transport to. So we're here to learn more about strokes. So Garfield Medical Center is a primary stroke center for us, meaning they meet specific criteria to come here for a stroke. So coming here for the opportunity to learn more about strokes and the procedures that they use past the treatment that we provide them. Good for us to see that need for how quick we need to get them there and how fast that we can recognize when someone's having a stroke.
Most important thing is to realize when we're having a stroke, right? Is to spot a stroke. So we use the acronym Be Fast. 87% of strokes are going to be ischemic strokes, right? So ischemic meaning there's a blood clot in that particular part of the brain. We have what's called a stent retriever. So if you guys can look at this device here is basically a cylindrical mesh device that's laser cut in the middle. You'll notice it kind of opens up. Yeah, it's made out of nitinol. So this can go into the brain. You take a sheath from the femoral, you take all the catheters up to the brain, and you place it where that clot is, essentially. And then you let it sit there for a good 5 minutes, and then the doctor will remove this stent retriever. And a lot of times you'll see the clot fragments on this stent retriever.
I am the medic intern here at Monterey Park from Montebello. Here at Monterey Park, we do get a lot of stroke victims, so it will help us tremendously to not have to transport to a farther hospital and be able to come here to Garfield. So having that proper education on knowing what it is and the symptoms of it will help your family member out.